Hey guys, my name is Carl, and today I'll be answering the question, what is schizophrenia? 1 in 300 people suffer from schizophrenia, and it is a mental disorder that can impact a person's view of reality. Schizophrenia is classified as a psychotic disorder and can range from mild to disabling. Some of the symptoms of schizophrenia include thoughts of other people reading your mind, delusions or voices, disorganized speech, lack of normal function, ignoring hygiene or emotion, incurable itches, and most commonly, hallucinations. So what happens in the brain when you have schizophrenia? The causes are unclear, but here's what we do know. A 2018 study showed that people with schizophrenia have thinner cortexes and show differences in the frontal and temporal lobe. The frontal lobe is what controls your memory, your motor skills, and your social function. And the temporal lobe controls your auditory stimulation and emotion. And this kind of makes sense that where a difference in these two parts of the brain will lead to the symptoms of schizophrenia. Gray matter is used to process sensation, perception, voluntary movement, learning, and speech and cognition, and white matter allows for communication between parts of the brain. But these are abnormal in patients with schizophrenia, and it's actually seen that they have less gray matter and more white matter, which causes the symptoms that they experience with schizophrenia. Since schizophrenia is genetic, people with a family history of schizophrenia are at a higher risk to develop it in their lifetime. Smoking, disease, drinking, taking drugs during pregnancy can all lead to birthing complications, which can affect the child's brain structure and brain development, increasing the risk of developing schizophrenia. So when does schizophrenia typically develop? It typically develops from ages 20 to 25 in males and 25 to 33 in females. And since your brain ages faster with schizophrenia, the life expectancy for people with schizophrenia is typically decreased by 28.5 years. If diagnosed with schizophrenia, there's two main forms of treatment that a patient could use. One being antipsychotic medication, which is daily pills that the patient can take, and it could reduce the symptoms experienced. However, there have been reported side effects where the user does not feel as motivated or not like themselves. And then there's electroconvulsive therapy, or ECT, and this is brain stimulation where small electric currents are passed through the brain, and this could also work to reduce the symptoms experienced by the user. If you or anyone you know is suffering from schizophrenia, please go seek help, because according to the World Health Organization, as many as 33% of all cases may go undiagnosed and untreated for years. And if left untreated, schizophrenia could lead to other mental conditions such as depression, and eventually it could lead to suicide. So please go seek help, and thank you for listening.